Today, I want to talk with you about depression. Depression is a chronic, non-psychotic state in which a person's mood is low or they are in a state of anhedonia or both. The general heading under which depression falls is known as dysthymic disorder. What are the symptoms of depression? Well, persons may present with a feeling of sadness, or they may have feelings of hopelessness, or some persons may develop the loss of interest or the lack of pleasure. Other persons may have short temper, or they are irritated. Some persons may be tired excessively, and then there may be memory loss. Some may have sleep disorders, and others may be crying uncontrollably, and persons may also experience reduced appetite and weight loss, and most persons will have a feeling of worthlessness. What are the causes of depression? Depression can also be caused by medications, pregnancy, postpartum state, abuse, associated illnesses, and chronic stress. Personal loss, such as the loss of a loved one, the loss of a job, the loss of a relationship, or any loss, can impact the emotion. What are the complications of depression? The complications of depression would include persons presenting with suicidal feelings or actually committing suicide. Persons may have weight gain. Some persons may develop pain or physical illnesses. Most persons will turn to alcohol and or drugs. And some persons may feel isolated from society, and others will develop self-mutilation, while others will have a sense of anxiety and panic disorder. These are all likely complications of depression. How is depression treated? Depression is treated with selective serotonin reuptake inhibitors known as SSRI. It increases the serotonin levels in the brain, which is known to control emotions. Common SSRIs are citalopram, escitalopram, and sertraline. Antidepressants have also been used in treating depression, and it is assumed that antidepressants relaxes the mind. The common ones that have been used are bupropion, mirtazapine, imipramine, and nortriptyline. The next topic I want to talk about is bipolar depression. What is bipolar depression? Bipolar depression is the spectrum of depression that has two opposite poles. On one end, there is extreme euphoria, which is the manic episodes, and on the other end, there is extreme sadness, which is the depression episodes. In between these two poles, there is tremendous and unpredictable mood swing. Here is a depiction of bipolar. On one side, we have the jovial person, and on the other side, there is the depression, the same person. It moves from manic episodes to depression episodes. There are 5 signs of bipolar that should be remembered. Number 1, persons usually have a feeling of sadness or emptiness and hopelessness for most of the days. Number 2, persons will have trouble sleeping at nights and difficulty staying awake in the days. Number 3, persons may have a feeling of worthlessness or feeling guilty most of the times. Number 4, persons may have neglected their family, their work, and their social life. And number 5, these same persons will usually have breakthrough. These breakthroughs are what is known as the manic phase, where they have a high sense of euphoria and sometimes irritability. I want to mention two neurotransmitters that are involved in depression and bipolar, and that is dopamine and serotonin. Dopamine is associated with thoughts and emotions. It also helps control movement in your body. A decrease will result in slow movement and decreased motivation. An increase, on the other hand, will result in increased movement and motivation. Serotonin. Serotonin is a chemical released in your brain by nerve cells. Serotonin is responsible for controlling mood. Decreased serotonin levels will result in sadness or dips in mood. On the other hand, an increase in serotonin will boost the mood. How is bipolar treated? Bipolar may be treated with second-generation antipsychotic medications such as olanzapine, risperidone, and aripiprazole. It is important to note that these second-generation antipsychotic drugs seem to control acute mania more effectively than the usual mood stabilizers such as lithium and valproate. Olanzapine, quetiapine, and aripiprazole are approved as maintenance treatment for bipolar disorder to prevent cycles of mania and depression. The next topic I want to talk about is panic attack. What is panic attack? Panic attacks begin suddenly without any warning signs. They can strike at any time and may have occasional or frequent attacks. There is extreme anxiety that is accompanied by physiologic manifestations. These persons develop the following symptoms: fear of loss of control, fear of impending doom, flashing visions, hyperventilation, palpitations, breathlessness, chest pain, sweating, shaking, headache, chills, nausea, abdominal cramps, dizzy feeling, numbness, and suicidal ideations. Panic attack is best treated with SSRI. Fluoxetine, paroxetine, and sertraline have been approved for the treatment of panic attack. Venlafaxine is a selective norepinephrine reuptake inhibitor and is approved by the FDA for treatment of panic attack. Also, high-potency benzodiazepine like clonazepam and alprazolam may be used in combination with SSRI to treat the acute phase of panic attack. Once the SSRI have kicked in, the benzodiazepine should be tapered to prevent dependence. The next topic is anxiety disorders. What is anxiety disorder? Anxiety disorders involve repeated episodes of sudden, intense fear, anxiety, and nervousness that is usually triggered by some type of events. Anxiety disorders can be subdivided into 1. Generalized anxiety disorder. 2. Social anxiety disorder, which includes social phobia. 3. Separation anxiety disorder. 4. Panic attack. 5. Obsessive compulsive disorder. And 6. Post-traumatic stress disorder. Anxiety is a mental, emotional, and physical condition. Anyone that has anxiety or knows someone that has struggled with anxiety can identify anxiety by some of its most common symptoms. These symptoms include nervousness, sweating, exaggerated or irrational fear, rapid heartbeat, a feeling of extreme uneasiness or apprehension, difficulty managing thoughts, unable to think clearly, shortness of breath, muscle soreness or aches, and feelings of lightheadedness or dizziness. What is the treatment for anxiety? The treatment options include therapy and medications. The medications include benzodiazepine and antidepressants and buspirone. Benzodiazepines are the drugs of choice to treat acute generalized anxiety disorder. They are normally given orally. Diazepam and clorazepate are the most rapidly absorbed benzodiazepines. Lorazepam does not have active metabolites and have a half-life of 10 to 20 hours. Antidepressants are the first-line treatment for chronic anxiety. Buspirone may be used in generalized anxiety. It is important to note that it takes 2 to 4 weeks before buspirone and antidepressant begin to work. Our next topic is psychosis. What is psychosis? Psychosis is present when a person experiences hallucinations, whether it is auditory or visual, and then delusions, disorganized thinking, and disorganized thoughts. It can be summarized that the person has lost touch with reality. Psychosis is a symptom that may be associated with schizophrenia or schizoaffective disorder. Schizoaffective disorders include both psychosis and mood. Schizophrenia, on the other hand, include auditory hallucinations, visual hallucinations, a lack of interest in things, delusions and paranoid episodes, disorganized thinking, and disorganized speech. Note carefully that psychosis and schizophrenia are very closely related. What is the treatment for psychosis? Antipsychotic medications are the treatment of choice. Typical or first-generation drugs include phenothiazines, thiazanthines, and butyrophenones. And the typical one is haloperidol. Atypical or second-generation drugs include clozapine, risperidone, olanzapine, quetiapine, and aripiprazole. Before I close, I'd like to summarize the treatment for depression, bipolar, panic attacks, anxiety disorder, and psychosis. Depression may be treated with SSRI or antidepressants. Bipolar disorder may be treated with olanzapine, risperidone, and aripiprazole. Panic attacks may be treated with SSRIs. Anxiety disorder may be treated with benzodiazepine in the acute phase, and psychosis may be treated with phenothiazines or clozapine. Well, I do hope this brief overview was useful. Thanks for listening, and I wish you well.